CBC News has uncovered a flaw in the country's healthcare system, and it could be costing thousands of Canadians a chance at having their eyesight restored. Their blindness is caused by disease. The holdup in treatment is caused by something else. The CBC's Cameron McIntosh has all the details tonight. Cam.
Wendy, not only is the waiting list longer in Canada for a cornea transplant than in many other countries, we're actually destroying some of the good corneas being donated for surgery here. At 90, Ray Stewart still hits his notes. It's basic stuff like getting around that's the real problem. He's nearly blind.
I don't know my next step I'm taking, whether it's going to be in a hole and I'm going to tumble or not.
Stewart has corneal blindness, damaging the cornea's ability to capture light and direct it to the optic nerve, a condition where the world starts to look like this. It's easily corrected with a transplant, but Stewart has been stuck waiting for 15 months.
There's nothing you can do. You're waiting for somebody to donate something for you.
CBC News has found in Canada, access to corneas depends a great deal on where you live. In provinces including Alberta and Ontario, the wait can be as long as 2 years. In BC, on the other hand, it can be less than 5 months. Meanwhile, last year in Quebec, 70 surplus corneas were thrown away because each province has its own system for dealing with corneas, and they aren't working with each other.
So they were stuck in a situation where they said, yeah, it would be nice to be able to take those tissues, but first we need to go through these hoops.
Experts say that's inexcusable.
In terms of tissue distribution, tissue availability, and eliminating corneal blindness, we are probably worse than some of the third world countries.
And a cup.
In 2008, Canadian Blood Services was asked to come up with a national plan. In 2011, it did. But it requires coordination from provincial health ministries. Many are looking at it. Manitoba's health minister admits progress is slow.
Is it going fast enough for those that are waiting? I don't think it is.
It certainly isn't fast enough for Ray Stewart. His message for the health ministers?
You take my place for a while and see how you like it.
Sentiments no doubt shared by 3,000 other Canadians who are also losing their patience along with their sight as they wait for a transplant. Wendy?
Thanks, Cameron.